Good morning. This is Dr. Ala from ACE Lab. Today we are going to discuss one of our main subjects in ACE Lab, which is the ACE Pico Protocol. Uh, Actually, it is all our work is related to stem cells. We can dedicate some videos to enlighten the community about the stem cells and its role in solving lots of medical mysteries. But for the professionals, they know already. There is no doubt about the stem cells and its efficacy and its importance in the medical field. However, we have some obstacles and some setbacks which we try to solve in ACE's lab, and this what we will discuss a part of it today, which is our Pico protocol, based on which all our products are produced. First of all, let us see what is the meaning of Pico, why we need Pico cells or Pico modulated cells in our life or our medical practice, and more subjects will come in later videos to explain lots of details. However, we can consider this is a primary video to enlighten the community, the scientific community, about our new principle, Pico protocol. We have also another new concept, which is ACE factor deficiency theory. Based on these two, the theory and the protocol, all our products are produced. We have a quick look for the meaning of Pico. What is the meaning of Pico? What is Pico? As we can see here, picometer is 1/1000 of the nanometer, 1/1,000,000 of the micrometer, and 1/1,000,000,000 of the millimeter. The question here is Pico is just a fantasy? We don't need it in the cellular therapy, and it is just a marketing campaign, or it's a real need for the cell therapy? The simple medical facts actually lead us to some questions. First of all, we need to admit that cell therapy, without any discussion, has many benefits, especially in treating the chronic diseases which has no definitive treatment today in the medical field. But cell therapies, since it started till now, lots of stories was told. We can consider it as scientific fantasies. One of these stories is the replacement of the injected stem cells to the body, to the damaged tissue, and its proliferation. This reached the degree that some marketing campaigns tell you that you have a damage of 300 million cells. Let us inject you with another 300 million cells to replace them, which is 100% wrong concept. The second wrong advertising campaign, which is, if we inject the stem cells or implant it in the gluteus maximus, it will migrate and go after what's called homing to the needed organ, and it will do the effect there. This is another myth. The simple medical fact tells us that the circulation in our body is quite well known and quite well studied since the ancient Chinese and ancient Egyptians till now. We have the heart. The blood comes from all over the body to the right side of the heart via the inferior vena cava and the superior vena cava. From the right side of the heart, the blood goes to the right ventricle, and from the right ventricle through the pulmonary arteries to the lungs, where the blood get oxygenated, and from the lungs, it comes back through the pulmonary veins to the left atrium of the heart, to the left ventricle of the heart, to be distributed all over the body through the aorta and upper circulation. Here we know in terminal organs and in terminal tissue, the blood get distributed through the capillaries. Capillaries are considered as the smallest blood vessels which make the blood and the elements reach the target cells. And these capillaries vary in its size and its diameter from 5 nanometer, 5 to 10 nanometer in the pulmonary capillaries, and can reach up to 5 micrometer in the terminal organs and in the muscle fibrils. From this range, 5 to 10 nanometer, we get shocked when we know that the stem cells diameter varies from 15 micron to 45 micron, according to the type of the cells. Here, the first fact come in front of us. So when we inject intravenously the blood vessels, the stem cells, and it goes from the right side of the heart to the lungs, how it will pass the very, very small capillaries here. The studies showed that 80% of the injected cells will be trapped in the lung. Okay, the other route of administration is the gluteus maximus. We implant it in one of the muscles. In the gluteus maximus, what will happen? The blood capillaries, as big as it can be, is 5 micron. How 15 micron cell will pass through 5 micron capillary? This direct give us the impression that some clots will happen here, some infarctions will happen here, some occlusions will happen here. And simply, the injected cells will not be able to pass the capillaries to reach the circulation, and it will be blocked in the gluteus maximus itself. Therefore, what will happen when the cells are injected here or trapped here? Simply, the immunity of the body will start to attack it in the form of the macrophages. And this what will lead us to two questions. Number one, if the cells are trapped in the muscle or in the lung, how we notice effect happens in the brain, how the heart functions can improve, how the liver functions can improve. These are legitimate questions. And the second question is, what type of immunity reaction will happen to these cells that are trapped in the lung or the gluteus maximus? Actually, the simple answer for these two questions come together, that the immunity reaction which happens to these trapped cells is the cause of the effect of the remote effect that happens in the brain and in the liver. That when the cells are trapped here, we know the mechanism of action of the macrophages. It starts to extend pseudopodia around the cells. Then it engulfs it in a vacuole. And inside this vacuole, lots of proteolytic enzymes will be excreted to dissolve the cell membrane and the organelle membranes to release the extract of the cell and all its bioactive enzymes inside the vacuole. Then by exocytosis, these contents will be released again in the blood. So what actually come to the blood is the bioactive peptides and the digested cell membrane and organelle membrane. So as long as the bioactive peptide come to the circulation, the bioactive peptides are not that big. They can pass through the pulmonary capillaries and can pass through the peripheral capillaries to reach the target organ by chemotactic induced by the interleukins to produce the desired effect of regeneration or repair of the damage or improving function or whatever the action needed is. So this is a simple explanation that when we inject stem cells, what actually happens. However, there are some setbacks or side effects from this story. Number one, the primary immunity reaction. A normal individual with normal immunity, this primary immunity reaction can pass and will not make any troubles. However, with an immunocompromised patient, this immunity reaction can be fatal. Number two, when we made studies on the gluteus maximus and the injected cells here, we found that the abscess, it is considered as abscess, it is considered as foreign body, as if bacteria was injected exactly. So the abscess which is formed here will heal from 5 to 15 days. And the result of forming abscess here is a scar, fibrous tissue scar. The scar ranges from few micrometers into some millimeters, which can cause a damage in the gluteus maximus. Lots of studies had showed this already. This is not the subject that we are in need to discuss now. Okay, so simply, this is the pharmacodynamics and pharmacokinetics of the stem cells when it is injected in the body. We come to what we do. All of this is still away from the PICO answer. The idea which came to us is, as long as the body is using only the bioactive peptides and the contents of the cell and the fractions of the cell membrane and organelle membrane, how can we destroy the cell inside the lab in this same manner which happens by the macrophages to benefit the body, avoiding the primary immunity reaction happens either in a muscle or in the injected place? And here came the answer. The protocols which are available to disseminate the cells and getting a cell extract. I will explain in a very fast way and brief way and simple way these protocols. Here is the cell membrane, double layer with phospholipids. And here is the nucleus, DNA inside and nuclear membrane outside. And these are the cell organelles like mitochondria, like smooth endoplasmic reticulum, like rough endoplasmic reticulum, like Golgi bodies, like the storage vacuoles and lysosomes. Each one of these components of these organelles inside the cell has its own function, and all of them together integrate to keep the cell alive and healthy and able to do its function inside the body. Now, these are the two functions of the cell. Number one, to maintain its life. Number two, to perform its function inside the body. The cytoplasm of the cell contain a part of these enzymes released when they communicate together to produce the function, or while it's getting to be stored in the storing vacuoles. When they communicate with each other, under the control of the DNA inside the cells. Okay, so the concept now is we want to get the full extract of these cells. The protocol which is followed now follows the osmosis pressure. The osmotic pressure, osmosis is the degree of concentration of salt inside a fluid. So the degree of concentration of the salts inside the human cell is 0.9%. So if we put the cell in hypotonic solution, which is 0.45, simply the water will fall, according to the pressure gradient or the osmotic gradient, the water will flow from the low concentration to the higher concentration, trying to equilibrate the pressure, the osmotic pressure in the two sides. This results in swelling of the cell, rupture of the cell membrane, and release of the cytoplasm and its contents to the fluid. But the organelles do not have cytoplasm, so they will not be affected by the osmotic pressure. They will die, but still they are integer with integer membrane, keeping the contents inside. And this make us get only 20% of the contents of the bioactive material of the cell when we use this protocol. The second protocol is using proteolytic enzymes to disintegrate the cell membrane and disintegrate the organelle membranes. But the proteolytic enzymes will not differentiate between the membranes and the bioactive material, resulting in digesting of all the cell contents into amino acids, which is not the desired result. We want to keep the bioactive material, which are polyactive peptides, phospholipids, and other catalysts in the form of coenzymes, in the form of enzymes, cofactors, all this to keep it active without being digested by the proteolytic enzyme. So following these two protocols will not give us the anticipated result of having all the bioactive material of the cell in our fluid. This is why we had to think about a way to disintegrate the cell membrane and the organelle membranes in a physical way. Physically, we get what's inside, we destruct these membranes to get its active material outside, destruct the cell membrane so that we get the full content of the cell. In a very simple word, without revealing lots of our protocol secrets, what I can say is we stored these cells as cubes formed of billions of cells. And we start to slice these cubes with a thickness of 0.25 micrometer. We understand that the cells vary from 15 to 45 micrometer. Make simple calculation here. We will find thousands of slices in one cells. Still, 0.25 micrometer is bigger than the 5 nanometer, which is the lung capillary diameter. So we had to take these slices, subjected to another pressure with 1,000 bar, with 100 bar pressure, putting it in a vacuole. Inside this vacuole, the pressure is 100 bar, resulting in disseminating the solid particles 1,000 parts, and making our calculation that this process to be repeated 3 times at least, resulting in particles when every 0.25 micrometer particle disseminated 1,000 times, then another 1,000 times, then another 1,000 times, we get at the end particles in the range of 15 to to 100 picometer. So the whole cell will be divided into particles, each particle in the size between 15 to 100 picometer. Again, resulting in can pass from the 5 nanometer in a very fast way. Let me give you a simple example for it. Suppose you have an elephant and you want this elephant you have an elephant and you want with the width of this elephant, for example, is 2 meters. According to the previous joke, there was a joke in the past saying to us while we are kids, how you fit 4 elephants in a Volkswagen car. This is the way to make an elephant with width of 2 meters pass through a door. The width of this door is 50 centimeters. Theoretically, what you will do is you will cut this elephant into pieces, slices. Each slice is less than 50 centimeters, say 45 centimeters. So it will pass without being lodged in this door. It can pass in, can pass out, can pass in, can pass out, and it will have a free movement. Actually, what we do is more that if we slice this elephant into 0.5 centimeter, so it will be very easy and very fast to pass without expecting any side effect for the door or for the body. This is what we do. The cell with a size of 15 to 45 micrometer, we divide it into trillions of particles, range from 15 to 100 picometer, to pass through the capillaries with a diameter of 5 nanometer. This gives us a result that the cells with its full integrity can pass through the capillaries, the part, all the contents, all the cell. Again, I'm repeating, all the cell. We agreed already that the body does not use the cell itself. The cells do not replace another cell. The body uses the apocrine function to get the extract of the cell to be affected in someplace else. The cells are trapped in the lung. We should not forget this. Cells are trapped here. And if it affects the brain or affect the liver, nobody imagined that these cells which are injected here will go to the brain, differentiate and become a brain cell. This is a fantasy. This is one of the fantasies that were created by some marketing campaign or some advertising agency. So that it's like movie, like science fiction movie. This doesn't happen. All the researchers proved this already. I don't need to discuss it anymore. We can discuss these researches in another session. So we know for a fact now that the body uses the extract and use the particles of the cell, doesn't use the cell itself. These particles stimulate the regeneration process through the factors which are present in the cell organelles and inside the cytoplasm to regenerate and repair the damage in the remote organs. And this is why we are cutting the cell in the lab to make the body avoid this immunity reaction and to create an application which is easier to administer, like can be sublingually, because 5 picometer you can expect to pass from any vein. You can expect it to pass from any mucous membrane in the body, buccal mucous membrane, nasal mucous membrane. It can be nasal spray, can be buccal spray, can be suppositories, can be wrapping in the vaginal mucosa, can be wrapped on the skin even. 15 picometer is much smaller than the pores of the skin. Therefore, cutting the cell into 15 to 100 picometer create for us a big range of important applications and make us avoid all the disadvantages of injecting and implanting stem cells, getting the same results better. How better? By multiple doses. When we have an oral application, we can give multiple doses a day. However, by injection, we cannot inject except once, minimum every 1 month, and better to wait for 3 months. Avoiding all the immunity side effects, all the side effects of injection, and all the financial burden which the patient carries by repeating injection and repeating torturing by the immunity reaction. Thank you. We will meet again in another video to explain more about the products of the Pico Protocol and how the Pico Protocol actually changed the life of many patients of ALS, of Alzheimer, of Parkinsonism, of stroke, retinitis pigmentosa, diabetes, diabetic nephropathy, hepatic impairment of hepatic enzyme impairment, and psoriasis. Thank you.